Okay, good afternoon. I hope you can hear me. My name is Dr. John Chan. I'm a consultant cardiothoracic surgeon at CVSKL Hospital, and I'd like to welcome you to our webinar today. So this is the aorta. So the heart is here. The aortic valve is here. It separates the aorta from the heart. So this part of the aorta is the ascending aorta. This is the aortic arch, and this is the descending aorta. So aortic dissection is, as we know, a tear in the aorta. The aorta typically has three layers, and what happens in aortic dissection is that one of the layers of the aorta gets torn. Typically, this is due to high blood pressure, which is the most common risk factor for aortic dissection. A lot of these patients may also have some weakening of the aortic wall from connective tissue diseases such as Marfan syndrome. But by far the most common cause of aortic dissection is hypertension or high blood pressure. So as you can see from this illustration, a tear has occurred in this layer and then blood tracks in between the layers of the aorta. So this is a very painful condition, and the most common symptom for the patient is severe chest pain or back pain, and it will be the worst chest or back pain which the patient has ever felt. So the history is quite classical, a sudden onset of severe chest or back pain. It can often be mistaken for coronary disease, for heart attacks, but the index of suspicion must be there if the pain is of sudden onset, is of severe, of great high severity, and is not improving with the nitrates or the GTN which you would give for angina. And of course, the main risk of this condition is that if it's not treated urgently, the remaining layers of the aorta may also tear. And if that happens, then of course the patient will not survive. And the other thing which can happen is the tear may occur with leakage of blood into the pericardium, causing pericardial tamponade. And that would again be a cause of mortality. And a third thing which can occur is that this is the aortic valve here. It can become incompetent. It can start leaking acutely, and the patient can then go into acute heart failure. So the symptoms of this condition is chest or back pain, shortness of breath, or a loss of consciousness. If the aortic dissection involves the arteries to the brain, then that can cause a loss of consciousness. So the investigation for this is by CT scan. And you can see on this CT scan here that there is a tear. This is the ascending aorta, and this is a descending aorta. And you can see that there is a tear involving both the ascending and descending aorta in this patient. The aortic dissection of the aortic root and the descending thoracic aorta can also be seen on echocardiography, but the gold standard investigation for aortic dissections is a CT scan. So if the dissection involves the ascending aorta, this part of the aorta, it is called a type A dissection. If it does not involve the ascending aorta and is limited to just the descending part of the aorta, then it is called a type B dissection. So generally, if you have a type A dissection, that requires surgery to replace the torn part of the aorta. If the dissection is limited to the descending thoracic aorta, this part of the aorta, then in most cases, they can be successfully treated with blood pressure control. So adequate blood pressure control is needed for all cases of aortic dissection. In the case of type A aortic dissection, they would require surgery. In most cases of type B aortic dissection, they do not require surgery. Most of these cases can be controlled with adequate blood pressure control. And for this particular condition, the best medication to use for blood pressure control is a beta blocker, because that will slow down the heart rate and it will also slow down the force of the blood in hitting the aortic wall. So the first line treatment for blood pressure control in this condition is beta blockers, and only after you have maximized the dosage of beta blockade, getting the heart rate down to about 60, and if the blood pressure is still not controlled, then you can add other forms of antihypertensives. So this is an example of a patient at surgery. You can see this picture here is the aorta, which has been resected. You can see this is the aortic wall. You can see this flap of tissue, which shouldn't be there. This flap of tissue should be uh, attached to the aortic wall. In this case, you can see it has detached. And behind this flap here is actually a hole where blood has tracked out of this aortic wall, and you can see there is hematoma on the outside of the aorta as well. So this patient had the ascending aorta replaced, and this is a Dacron graft. This is the new aorta which we would have stitched onto the torn part of the aorta. This is the heart here, and this is the arch of the aorta. So this is a treatment which we really need to do within as soon as possible. Once the diagnosis is made, surgery should be performed as soon as possible to save the patient's life. This is another example of a patient with an aortic dissection. Again, you can see the torn part of the aorta. Here you can see that the aortic arch is very involved and diseased. And so this patient needed the arch of the aorta to be replaced as well. And we have various types of graft we can use to suture onto the aorta to replace it. So this part of the graft would replace the ascending aorta, and then we have small little limbs here which we can join to the blood vessels supplying the neck. So after surgery for an aortic dissection, don't forget that in most cases, the aortic dissection is not limited to the ascending aorta and the aortic arch. It involves also the descending thoracic aorta. But at surgery, we've only replaced the ascending aorta and the aortic arch. So the good blood pressure control is very important because the patient still has a dissection of the descending thoracic aorta, the lower part of the aorta. So, fortunately, in most cases, if we control the blood pressure adequately, then the descending thoracic aorta does not cause problems, and patients can do very well for many years after surgery with a descending thoracic aortic dissection if the blood pressure is well controlled. So that is very important. Now, if we do have problems with the tear or the dissection in the descending thoracic aorta, usually this will be many years later, then we have the option of treating this. And in most cases, this will no longer be by open surgery. Nowadays, we would do endovascular surgery to treat a condition in the lower part of the aorta, the descending thoracic aorta. So we can, through a small incision in the femoral artery in the groin, we can push up this graft and then release the graft in the descending thoracic aorta to exclude the dissected part of the aorta. This is a procedure called thoracic endovascular aortic repair, or TEVA. So in most cases of dissections involving the descending thoracic aorta, we no longer need to do open surgery. We can control it with blood pressure, medications, and if some intervention is needed, say if the dissection is continuing to progress, then we will recommend an endovascular approach to treat the condition. So the take-home message is that aortic dissection involving the ascending aorta is a surgical emergency. Uncomplicated descending thoracic aortic dissection can be managed medically with blood pressure control. Complicated descending thoracic aortic dissection should be managed by TEVA, this endovascular treatment. I think that's all I have today. I'd like to thank CVSKL and Servier again for organizing this. And I'd like to thank all of you for joining us today. I hope that it has been interesting and useful. And I'm happy to answer any questions you may have. You could type them in on whether you're on Zoom or on Facebook, and I will answer the questions.